Welcome to the show, everybody. Micah with Coronavirus-Diaries, and today I'm fortunate enough to be able to speak with Dr. Andrew Scarbrough, a licensed practicing psychologist in Minneapolis. Dr. Scarbrough, how are you?
I'm doing well. I'm hanging in there like everybody else. What are we into now?
We're at like 8 weeks, right?
Something?
It's like 2 months.
2 months approximately, give or take a little bit of time. Yeah, they said I'm a licensed clinical psychologist. I've been doing these periodically with you to try to check in, talk about some mental health issues during this pandemic. And yeah, we thought we got maybe a good topic we could riff on a little bit today and talk about some psychological techniques or theories or practices that might inform how people kind of think and act in society nowadays with all the changes.
Yeah, so you transitioned your entire practice from in the office, face-to-face, working with clients to an online-based platform like what we're doing right now.
Yeah.
The interesting thing is that, I've known you for a long time. Before we started this session, we catch up like we always do. We were kind of tossing around some ideas about, what can we talk about? And your thesis came up, and this notion of digital treatment, which is literally what you're doing right now.
Yeah.
And that led into a further discussion, which is something that I know you're familiar with, is the virtual reality. There's a certain Oculus Quest plug, but this notion of being like, it's really, really cool to be able to get dropped into a virtual environment. And I asked you to, maybe shed some light on this and how you think it could be maybe paving the way. Maybe everything that's going on right now is just kind of getting everybody used to this notion or this idea of accessibility being in your own living room versus having to drive anywhere or fly anywhere.
It's kind of crazy that this technology hit a pretty high point in its development right before this pandemic too. When I did my dissertation initially, we were looking at email therapy. Like that would be a pretty old school. We were even looking at, or I was looking at, even asynchronous, we call it therapy, where you would send letters back and forth to people and communicate with them in these very old ways. And then, of course, it incorporated, these online chat windows that people would open up and they would chat back and forth with a therapist.
Sure.
And
that's
then,
kind of what we're doing right now, right?
Well, I would say we're going to step beyond. We got the video component to it. We don't have to type. We got audio and video, and so that was the sort of pinnacle of technology, and it wasn't that good. I mean, what Zoom has done now, when I created my sort of dissertation and finally developed it, we're talking like 10 years ago. Like these type of Zoom meetings and interactions that people had, the technology was a little bit old, but the general finding was I had approached it from an ethical angle. As is this can this be confidential? Can you provide adequate services for people through this medium? Are people representing their credentials and their trainings and their qualifications accurately? Is there any enforcement on this stuff? I looked at it through that way because it just made sense for me in academia as a good topic. But as far as the effectiveness goes of this type of approach, I am practicing exclusively online now, but the research I think is pretty clear, and that it's not as good as face-to-face, as what we would call just traditional approach.
And you're not referring to like I can't imagine anything to deal with email would be beneficial.
No, that stuff was like garbage. I mean, I would think that with the older school approaches, like something was better than nothing maybe, but not by much. Like it might be better if somebody had no resources. But the general finding with online therapy services, they're predicted to be very fast growing. Like I think there was a study by I can't remember the citation, but they said, and I opened up my presentation with it, that said the internet service industry is expected to be the second fastest growing service industry within the next 10 years. 10
This was like 10
years,
years ago.
this is like, yes, this is like 10 years ago. That's where we're at now. I mean, look what's going on with Zoom. Look
Yeah.
what's going on with how much people are doing online now. Um, Holy crap, they were right. I mean, really, this is what everybody's switching to now. There's a whole new way of life, and so people, I think, can benefit from looking at, you know, what does this do? Are there any other options? Well, right now, not really. This is the way most people are kind of living their life. There's people, doing mitigated risks out there now. But as far as telehealth therapy services, they've been doing this for a while, and um, the difference is shrinking. The difference is getting smaller and smaller, but it's still pretty clear that the face-to-face is superior. I
Why do
think,
you,
yeah, I think,
why do you think that is?
I don't know. I mean, it maybe has something to do with our like primal lizard brains, like being close to somebody. The sort of acuity of their sort of facial expressions is immediate. There's not the fragmented sort of.
Oh, right. The
Yeah,
lag.
I was messing with you there a little bit, but yeah,
Yeah.
you
No,
get
sorry.
that sort of thing in the middle of a conversation, or you've had this experience too. It can be frustrating starting with an interaction where you're like,
Every single time.
and you're typing comments like, click the little gear icon, switch your bike to this, and
Right.
you're doing all this stuff. That can be frustrating. So those technology issues can be kind of frustrating. I feel like there's just a genuine feeling of being closer to somebody when you're talking about something with them and they're there.
Do you think that maybe in some instances, it's reaching a demographic or an audience that otherwise wouldn't be receiving any sort of, they wouldn't be reached at all, like some people in remote regions of
Yeah,
the earth?
that's where the number one purpose was. So if you think of
Okay.
somebody in like a very rural part, I grew up in North Dakota when I was
Middle
younger.
of Alaska.
The middle of Alaska, yeah. And let's say they have dissociative identity disorder. It's like formerly multiple personality disorder. There's not but a few people that are qualified to treat that in the world. And let's say you're in Alaska, and the nearest provider is thousands of miles away. Like, what are you gonna do?
Right.
Your options. Um, yeah, or it was something a little bit more reasonable. Let's say you have somebody with an eating disorder who lives in 3 hours away in a rural community that's 150 miles from the nearest big city. What are you
Right.
going to do? I mean, that's definitely where this comes into play, and it's going to be better. Um, there, there are some risks. There are some populations that can be a little bit more difficult to deal with if you have suicidal people, or if
Sure.
you have people with a severe chemical dependency. They have really serious addiction problems. You could get somebody to be like, "They ain't gonna smell my breath. I could do this session drunk," and they show up and they're
So it's
intoxicated.
defeating. It's broken before it's even started.
Yeah,
Yeah.
yeah. I mean, there's not a real sense of accountability. It's like the person there isn't really real. If you think about like road rage and how people, they don't really view the car as like another person. They view it as a sort of like an object, that it's
Sure.
something not really there. Like, they could, um, with road rage, you could say whatever you want. The person's not going to hear you, or like, what's the real consequence? What are they going to do? So a person could feel less sort of held to a less sort of serious standard to be sort of committed to stuff. There's actually a phenomenon called hyperpersonal communication too,
What
where
is that?
people will share more than they would with a person face to face. They will feel like, well, I don't really know this person. I don't know where they're based at. I could tell them about the worst thing that's ever happened to me. I could tell them about all my weird little whatever. Like, they could talk about their sexual proclivities, or they could talk about, an incident that happened that they've never told anyone about, because there's this separation, this electronic barrier separating somebody.
Does it still do the same thing when they do share something like that?
Yeah, it
where
can be really
is it kind of
cathartic.
like exposure therapy in some capacity, or maybe that's not the right term, but they're,
Yeah,
yeah,
it can be. Um, I think there could be an advantage in certain situations too. Not just based on geography, but there could be some people who would, they can offer these type of services a little cheaper to people sometimes, which also means you're sometimes getting a less quality type of service.
sure.
But you can also get people who might, be a little bit more open, and they're like, wow, I did share about that childhood abuse, and my world didn't end. And I feel a little bit more confident that I could talk to somebody about that. So there could be advantages to that. I would be curious to see what they could do with VR. I got one of these VR headsets, and you and I have talked about the technology applications.
Well, recently you had shared that you could put it on and you can go into some of these games and there's other avatars, but it's actually people.
Yeah,
You're literally communicating with them. Maybe what, how do you think maybe gaming, is it like gamification of therapy? If there were like just somebody being in a social environment like that where they're actually engaging with somebody else, is that, do you feel like that is something that has benefits to it?
it's interesting. I noticed I've probably played this one game where I realized I was in the middle of it and I was talking out loud, and somebody was like, it took me about like an unusual amount of time to realize it was a real person. Because I was like, I didn't know that my headset could do that. I didn't know it could pick up the audio.
Yeah.
And I all of a sudden, it would have been a funny clip if somebody had videotaped me slowly realizing like, hey,
Wait,
this
wait,
person,
what?
like, what? You just said what I said. Yeah, I said what you said. What? How did you say? Like,
Did
this
you
is
think
a
it was
cool
AI?
lot. You're like, what?
Did you think it was AI or like a robot?
I thought it was something that they had programmed for a while, and slowly, as they were doing things that I knew that would be really hard to program for AI, I was like, wait, you're a real person. And they were like,
Awesome.
yeah, like no crap. Like, what, you didn't know that? And I was like, no, I didn't know that. And
Old dogs can learn new tricks.
yeah, so I noticed this though too. If you think about trolls, people that get on these games
Sure,
and they
toxic.
talk crap to each other,
Yeah,
right?
toxic individuals.
Yeah, they just really badmouth each other. They say these like horribly racist things, or these like they're usually kids who are trying to like flex and they're swearing and doing stuff like that.
There's no
Um,
accountability and no attribution. They
there's no
can,
accountability. You can't
yeah,
see the person's face. I mean, in these games, you kind of work a little bit cooperatively sometimes, so it doesn't really benefit you. I haven't gotten one person who's been like a rude, ill individual who's talked smack. And there was one kid. And this is, I won't play with kids because I was playing at like midnight or something like that, and there was an 8-year-old kid who was staying up past his bedtime, and his mom was like yelling at him, and he was being a jerk, and he was like shooting me in the head and shooting my character in the head and like singing songs, and he was like, "Oh, come on, mom, one more." And I'm like, no, like he was just a little jerk. But um, like other than that, I think the ratio of people who are kind of just nice when there's like a real person that's talking to them, there's like an avatar that's like it's not a visual representation of you, it's kind of what you've created. But I
sure.
was thinking about what would this be like if there was some sort of, they have the technology now where they can read your hand movements without a glove or anything, and they can
Sure.
see what your hands are doing and track them into the game.
Yep.
How far would we be away from that being able to be the case with your face, for you to be able to sort of channel a virtual environment and be able to like in real time see somebody's facial reactions as they show
Oh, yeah.
concern, or like a therapist would show concern or empathy, or I mean, if you could really bring technology forward, I wonder like how much that gap could be bridged
Well, we were
between.
talking about that a bit before we started. Was there's companion robots for elderly where they'll be in, they can have them in their homes, the elderly, or even people that are, maybe they just need somebody around. But that's one of the elements or the aspects that these robots do is they show, they have facial expressions and they respond, they have empathetic response, and they show that it helps boost morale. in these people to
I
just
can
have
see
somebody
that.
to communicate with.
Even if you knew, like, right away, you're like, well, this isn't a person. Like, something to sort of mimic that could be um, useful for somebody. There could be, a market. We were kind of joking about this for, like, companion robots, like in a
It
different
can
type.
go very different. It
It
can
could
go
go a
full
very
spectrum.
different way for
Yeah.
people, and they can become reliant on, AI technology for that. But
Never leave the home.
never leave their home. They'd be like engrossed in these sort of artificial fake relationships. I'm not really too worried about um, AI coming in to sort of take over, because when I started looking into this as I was going through my dissertation, a question I considered was, could a robot or AI be programmed to do a therapist's job? If I were to, the most basic question of it was
Machine
like,
learning. I mean, through machine learning and artificial intelligence, it could potentially, in theory, become
if
better.
I were to create a list of like 100 empathetic responses, there are
Million.
some,
Like all of them.
yeah, I mean, but like I could probably do it a reasonable job with some percentage of people with 100 responses. I mean, the classic, and this isn't what therapists do. There are some therapists that do this. I don't do this, where they'd be like, how does that make you feel?
Yeah.
I see, that must be difficult. Tell me more about that. That
So
sounds like
every
a
single
difficult
meme.
challenge. But like you could just create a bunch of those, and then you could have keywords that would flag, or somebody would be like, oh, I have a drinking problem, I don't know what to do. Alcoholics Anonymous can be very helpful. There's a 12-step program near you, and at 7 o'clock, 1.2 miles away on North 34th Street.
I mean, really though, with machine learning and artificial intelligence, you think about how many hours you've spent studying and
Yeah,
testing and getting licensure and your experience. If you have, a computer program that can work 24 hours a day,
yeah,
but then you multiply that across multiple systems, so it's putting in, 20 days worth of work every, 24 hours worth of work across 20 different systems. The amount of experience and the amount of knowledge that it could develop
it
in
would
the
be
same amount of
impressive.
time.
I get what you're saying about the sort of potential of it here. When I think about all the different responses that a person could have, like the sort of the physical responses, like maybe you could get an AI to do some of that. Okay, what about self-disclosure? What about, a lot of therapists don't do this too, but I think like the unorthodox style of therapy would be a harder, like an impossible one. Because I'm an unorthodox therapist, I would say that it's not a bad thing. It's just a thing that I go off script. I go off, I don't do the sort of reflective, empathetic responses exclusively in sessions. And not a lot of therapists do it exclusively, but some are just kind of reflecting pools for people.
Sure.
If I were to say, yeah, that was pretty tough. I remember a time where that happened, and I felt like this, and it was difficult to overcome. But I tried these few things, and and sharing an internal perspective. I don't do that a lot, but sometimes it's relevant. And if I have a short story that offers a point to the client that I think could be meaningful, I'll share that with them. Um, there
For a
are
robot
things,
to do that, it might be a little odd because they're going
yeah,
to,
they've never had a childhood, they've
yes,
never had a youth, that they've never screwed up and had to deal with shame and guilt and fear, and they don't have
never
an
crashed the parents'
understanding.
car for
Yeah,
taking it out late at night.
they've never had that experience.
Yeah.
Yeah, they've never had that experience. And so you would, I think, cognitively, you would sort of, after a while, after a few little flaws, because I don't think over a long period of time that AI could do it perfectly. Like, you would get some weird sort of thing that reminded you that, like, oh yeah, that's right, this is fake, this isn't real.
Well, I think in 10 years, we'll have to revisit this conversation
It would be
and
interesting,
we'll
like, to think of,
reevaluate.
yeah, if I think about you know, 10 years before I started my dissertation, and then 10 years before that, like, they were inventing internet. Like, like it'd be interesting to go through the cycles of, like,
AOL dial-up,
I remember that. I remember getting the
some
CD for,
MySpace.
like, what was it, 100 hours or 1,000 hours of like free AOL.
Yeah.
You got mail. Like, oh my God. I remember going to the library in elementary school, and they had the sort of, they were like, we have this new thing called the internet. Let's connect. Like, like
After
the
you finish
long
your game of
dial-up.
Oregon Trail, yeah.
Yeah. Oh
Yeah.
God. And then it was like, oh, let's load Netscape. And it'd take like 60 seconds for Netscape to load on the computer. And yeah.
So in terms of virtual reality technology and online therapy of sorts, it sounds like what you're saying is that yes, it can fill a bunch of maybe gaps or niches within you know, a variety of different clientele, whether they're in remote regions or, you know, wherever they're at. But at the same time, right now it seems like you feel like it may not be able to achieve the same level of effectiveness as a real person in a real space.
I feel every day that I'm offering a substandard service. Every day.
Because it's purely online.
Yes, because it's purely online.
And
I
because the
feel that
last
every day.
decades you've been doing it face to face in a space.
Yeah. And now it forced to do this medium. There's not an alternative for people. And I don't feel that with every patient. Some patients flow into this seamlessly, and I don't feel it with them. There are some patients that I feel like talking to them is like pulling teeth, and it wasn't when I was meeting with them face to face.
Sure.
And their level of disclosure is smaller. It's not as deep. The interaction isn't as good. Every day, I feel like, yeah, you're offering a substandard service. And so it's better than nothing. We take what we can get right now. But
well, so Monday was the state of Minnesota started doing its stepped reopening.
yeah,
Is there any talk in regards to your industry when you're going to be able to go and start engaging in a face-to-face manner again?
I'm curious about that too. I checked my email about an hour ago to see what the plan is for that. There's not anything in place yet. And I think if I were to push hard to do it, like nobody would stop me because I'm a healthcare worker. Like I'm a different kind of healthcare worker, but I'm a healthcare worker. I got a
Right.
letter from the state that grants me permission to do that. I don't know that going to the office would be much more for me now than me getting out of the house to do that. I think there might be a couple of clients that would, come in to do that. I'm sure there would be a few clients that would do that, and I would welcome them, and I would be fine with that. But I still think I'd be doing well over half of my business online,
Sure.
and so that's I'll integrate at a level that's reasonable. I think what I was talking about with one of the clinic directors I know, and I work at two different jobs, but one of them was we're doing a hybrid type of system now too, where maybe one day I'll have in-person hours and the next day I have online hours exclusively.
Sure.
And there's a blend of that. And so where I think people are in the process now, we're kind of looking at, even though they kind of reopened a lot of the stuff, that by about June 1st is my hunch, is that we're going to get an idea of like what this hybrid model can look like. And I'm eager to see that happen.
It's not far out.
No, and the way that we manage the office visits, we have people spaced out with wide distances in the waiting room. We have Purell stations everywhere. People come in the office. I'm not within 6 feet of them. When they leave the office, the support staff come in and they spray stuff down and wipe stuff down.
Are you going to be wearing a face shield and a mask and scrubs with rubber gloves when you're communicating with clients?
I hope the face shield stuff doesn't happen. I really don't. But
that would be a literal barrier and maybe a theoretic barrier between you and your client, huh?
I feel like it could be, and I think we could be far enough away too, where it might not be necessary. I think as long as they talk about low risk, moderate risk, high risk. If I'm in an office with somebody, they don't appear sick, I don't appear sick, we're not face to face, maybe we're a little bit angled off from each other, and we're like 6 or more feet apart. I know people would argue with me on this, but I'm not worried about it. I really am not, and I don't have a very vulnerable sort of situation where I'm coming back home to a grandmother that I could kill if I got.
Well, in lieu of the data that we've all become privy to over the last few months, in the state of Minnesota, 5.6 million people. There's, as of today, just around 750 deaths. That's like 0.000%. it's far less than even 0.5%, or even half of a 0.5% of the population here. So it's, I think, we're all learning from the information and the data that becomes available as it becomes available. And
it's very hard to quantify the human adjustment and that's impact on, if anybody who's a social scientist, which is what you call psychology, knows that it's very hard to quantify social behavior. You can quantify the spread of a virus, and you can get samples of that. It's very hard to quantify, how many times have you maintained social distance, been perfect, sort of perfectly in cross situations? What have you done to and incorporate that data into the sort of technical virus data? That's a real hard thing to do. And I don't know that anybody has really, to my knowledge, talked about, like, the average person follows social distancing practices 75% of the time, especially in these situations, which will greatly reduce, I don't know. I haven't seen research on that.
I realized the other day when I was pumping gas, right? Like, I try to, I still try to have hand wipes, and I'm still trying to play that game a little bit.
Pumping gas, you probably want to be a little safe on that.
Yeah, I mean, I pumped the gas though. And I went and I used a different hand to get into the car to get the wipe, and then I realized, like, oh, I grabbed the bag with the other hand, and then I'm like trying to wipe my hands in the bag and the door, and it was just kind of like this failing process over and over. And I'm just like, you know what?
Yeah.
If anything, I just like rub it, like it's all. So I'm just gonna go ahead and
laughing.
Accept, what it is. But
I always feel like I'm continually exposed by my keys. Like, when I think about like getting in my car, I'm like, okay, like I'll have one hand to sort of like, I'll try to glove one hand up like Michael Jackson sometimes. So I'm like conserving gloves, and I'll be like, oh, I'll touch all the dirty stuff with my gloved hand. But then I'll handle my keys and I'll pass them back and forth. And I'm like, oh, I've just contaminated my ungloved hand or something like that.
Yeah.
Or you think about the face masks, and if you take them off and put them on, it's like, well, I've only used it for 30 seconds. I want to reuse it. And then you put it back on, and you're like, oh, but that was my contaminated hand. And when I set it down, I could set my mask down, and that could absorb the COVID particle. And
I can only imagine what it'd be like to be truly OCD, to where, like, I don't know, I have no idea what's going on aside from like processing this information of like, oh, this thing is happening or something along those, and just to think, oh, I touched that, and then that touched that, and like, it would just seem like chaos.
I'll do the glove stuff with in public to protect other people and stuff a little bit, but I just do it in public.
Sure.
But I stopped doing the glove stuff, and now I'll just, if I go into places, I'll just go barehanded, and then when I get out in the parking lot, pull out the Purell, which is available now, and just lather it up.
2 months ago, based on the models that were being widely distributed throughout the professional community and the peer-reviewed community, these models were suggesting a scary statistic of mortality and deaths, and that. Fast forward a number of weeks and a month, and then it's like, oh, actually it was completely wrong, and in fact it's the data is organic and it's constantly changing. And I think myself, for people that had kind of taken those precautions, it just shows a certain degree and level of empathy that even if you're not concerned about it for yourself, there are those out there that it could still very well impact. Actually, so we're both fans of the UFC. Khabib Nurmagomedov, the featherweight champion. It sounds like his father, 155 division, Conor McGregor. So it sounds like his father just got it, and he's actually really, really sick. So it's out there, right? It's impacting people, some people in the limelight. But what can you do? In regards to the online therapy, though, I think it was really cool, enlightening, to say the least, and it's going to be really interesting to see where it goes. Like you said, 10 years ago, what's happening right now, it was kind of like, oh wow, that's going to be cool when it happens, and well, now we're here, and it is happening.
It'll be interesting to see the way they try to fit people out to get them to. I think that's the rub in AI, is trying sort of not even think that it's an AI.
We got a little bit of lag going on.
Oh, do we?
Yeah. Well, I know we're quite a bit over the time. Was there anything that you were hoping to touch base on that we actually didn't get to?
No, man, that's good. Yeah, good discussion today.
Outstanding. Well, Dr. Scarbrough, I appreciate it. Thank you for your time. As always, it's a pleasure.
All right, we'll see you later.
Yeah, and for all the viewers and guests, stick around. We're going to have more of this stuff kind of coming your way. There's information in the About section below if you're trying to reach out to Dr. Scarbrough. I'm sure he'd be happy to hear from you. Until next time, take it easy.